guys, my name is Julia. Welcome back to my channel. Today's teaching, we will be talking about a stroke. Guys, before I go any further, please remember to subscribe to my channel. This way you won't miss any content that I post. Please give me a few thumbs up for the algorithm and remember to comment down below. Okay, now let's move along, and I'm also gonna do a little disclaimer. The information that I am providing is based on my experience and my knowledge as a nurse. I am in no means providing medical advice, as I'm not a medical doctor. Please remember to consult with your medical doctor for any health issues that you may have. So let's move on. So as you know, I am a home health care visiting nurse, and I do a lot of visits to patients' homes, teaching them their diagnosis and how to better manage their disease. This prevents worsening of the patient's condition. It also prevents rehospitalization, which is a big thing. As you know, home care patients are patients who were recently discharged from the hospital. So teaching the patient disease management is very important. Okay guys, so let's talk a little bit about a stroke. What is a stroke? A stroke is a blocked artery or leakage or bursting of a blood vessel. This is also called an hemorrhagic stroke. A stroke is a medical emergency and it's important to get treatment right away. Okay, so let's talk about some of the signs and symptoms of a stroke. So what are some signs and symptoms of a stroke? So we have trouble speaking, okay, paralysis, okay, headaches that comes with vomiting, nausea, dizziness. There are other signs and symptoms, but this is just a basic few. In the medical field, we use an acronym called FAST, and we teach this to patients because FAST means that you need to get to the hospital right away. A stroke is a medical emergency. The faster you get to the hospital, the better the outcome, and we explain this to patients. Okay, so what is FAST? F is for facial drooping. You may notice that your family member face is not symmetric. They may have facial drooping. If you notice something like this, you want to call 911 right away. All right. A is for the arms. You may notice that the arms is like flaccid, or they're not lifting their arms as usual. Weakness to any side of the body. All right. That's what that is actually. All right. So we have S. S is for speech. Okay, you may notice that your family member is having a hard time speaking. They may be having slurred speech. They may be speaking to you and what they're saying is not making any sense. All right, and then we have time. And time, I cannot stress enough how important time is. The faster the patient gets to the hospital, the better the outcome. This can reverse or prevent brain damage and even prevents disability. So these are just some very simple instructions, but yet life-saving. Okay, so remember to act fast in the event of a stroke. So what are some of the main causes of a stroke? Some of the main causes of a stroke are heart disease, heart disorders, such as AFib or atrial fibrillation, hypertension, high blood pressure, the same thing as hypertension, okay, bad cholesterol, poor diet, lack of exercise, and there are others, but I think those are some of the main causes of a stroke. So I'm not going to do a long video about a stroke because there's a wealth of information on a stroke, okay? But it's very important to know the signs and symptoms of a stroke. And if you don't get anything from this video, I hope you get the signs and symptoms to look for in a stroke. This way, if you or your family member is having a stroke, you are better equipped to help them with the assistance that they may need to get to the hospital right away. Okay guys, thank you so much for watching. My name is Julia. Until next time, please remember to subscribe to my channel. As I mentioned before, give me a few thumbs up and comment down below. Thank you again. Bye.